your student nurse this morning. How are you doing this morning?
I'm good.
And hygiene. Oh my. Give me one moment while I put on my gloves. So how? It's such a beautiful morning, right?
Yes.
Yes. I these gloves are so sticky. Okay, I'm gonna go ahead. Can I borrow your wristband? Thank you. Can I have you verify your first and last name?
Alexis De Leon,
Thank you very much, Ms. De Leon, and your date of birth.
10/13/93.
Thank you very much, Ms. De Leon. Today I'm gonna go ahead and be performing a head to toe on you. That just means I'm gonna check from your head all the way to your toes. Have you had one done before?
Yes.
Yes? Okay, so you just know what I'm gonna be doing. I'm just gonna go ahead and be telling you if I see anything, note anything that I see. How are you feeling this morning?
Good.
Good? From a scale from 0 to 10, 0 being nothing, 10 being a lot, what would you rate your pain?
0.
Already checked her vitals, she would have been normal. I'm going to be asking you some questions. Some are basic general questions, and some are a little personal. Please be as honest as you can, and to your best of your knowledge, answer these questions, okay? So, do you know who the President of the United States is?
Trump.
Do you know where you're at right now?
At the clinic.
Correct. And do you know what today's date is?
August 26th,
Of what year?
2020.
Okay, good job. So that means you are alert and oriented. Now I'm going to ask you some questions about your medical history. Do you have any medical problems?
No.
Like heart problem, high cholesterol, hypertension?
No.
No? Have you had any surgeries? Like have your appendix removed, your gallbladder removed, any back surgeries?
No.
Any joint problems, any stiffness in the morning, any dislocations?
No.
No? Have you had any recent injuries or any recent hospitalizations?
No.
No? Okay, do you take any medications?
No.
Like any medication for the heart, any medications for the stomach?
No.
No? Do you take any over-the-counter medications like IBU, Tylenol?
No.
Do you take any herbal supplements?
No.
Like, herbs? No? Do you have any allergies?
No.
To medication or to drugs?
No.
Any seasonal allergies?
No.
No? Okay, so now I'm gonna go ahead and get started. I'm gonna go ahead and start with your head. If at any point you need a break, let me know so we can go ahead and stop, give you a moment to rest, okay? So I'm gonna go ahead and start with your head. I notice that it's nice and round. I don't see any open wounds. Have you had any recent trauma to your head, like hit your head recently?
No.
No? Were you, even if you lost consciousness for a little while?
No.
No? Okay, I don't notice any masses or any wounds on your head. So now I'm gonna go ahead and check your eyes. Do you have any, do you wear contacts or
No.
wear glasses? Have you had any surgery in your eyes, like LASIK surgery?
No.
No? Okay, I'll put this in here somewhere. I feel it.
There's none like that.
It's right here. Okay, so now I'm gonna go ahead and I'm gonna flash this light into your eyes. Just go ahead and stare straight at me. Before this, I would have checked your vision with the Snellen test. Okay, go ahead and stare at me. Okay, very good. Okay, very good. Very good. How do you feel?
Good.
Okay, so go ahead and stare. Now you're gonna stare at my pen. You're gonna follow it with just your eyes, okay? Now you go ahead and stare at my pen. And go ahead and stare back at me. Good job. Now go ahead and stare at my pen. Follow it with your eyes. Notice any redness in the whiteness of your eyes. I'm just gonna go ahead and pull this down. I don't notice it's nice and pink. Do you feel any dryness in your eyes currently?
No.
No? Okay, that is good. So now I'm gonna go ahead and check your ears. Do you wear any hearing aids? Do you have any hearing problems? Have you had any surgeries?
No.
No? Okay, let me go ahead and, I'm just gonna go ahead and pull back. I'm gonna go ahead and have you remove your mask. If you do feel like coughing, go ahead and let me know so I can step away, okay?
Right.
I'm gonna go ahead and just lightly touch your sinus area. Do you have any pain?
No.
No? Do you have suffer from sinus problems?
No.
No? Okay, as I'm pressing right now, do you feel any pain?
No.
Have you had any trauma to your nose?
No.
Have you had any nose surgeries? No? Okay, I'm just gonna go ahead and check your septum and your nose. Do you feel like you breathe from one nostril better than from the other?
No.
No? Okay. So now I'm gonna go ahead and have you blow for me. Go ahead and blow for me. Okay. Good job. So now I'm gonna have you close your eyes. And I'm gonna put something in front of you and tell me what it smells like, okay? I'm gonna go ahead and with my tongue depressor, I'm gonna check in your mouth. I'm gonna need you to say "ah." Have you had any have you hit yourself in the mouth, bitten yourself?
No.
No? Okay. Her mouth does not seem dry, it's nice and moist. Her tongue. Okay, go ahead and say "ah" for me. Her tonsils are still there. They're not red. I don't notice any puss pockets. And now I'm gonna go ahead and check your boundary. There you go.
Dude, ew.
Can you go ahead and now I'm gonna need you to blow a bubble for me. And stick and go ahead and stick out your tongue. Okay, go ahead and frown for me. Go ahead and smile for me. Go ahead and try to wink your eye. The other one, can you do the other one? Can you go ahead and raise your eyebrows for me? Down. Okay, good job. So now I'm gonna go ahead and assess your lymph nodes. I'm gonna go ahead and check your neck. If you can go ahead and turn this way for me so I can assess any vein distension. I don't. The other way for me. I don't notice any bruisings or wounds to your neck. Do you have any stiffness at the moment?
No.
No? Okay, I'm just gonna go ahead and check your carotid pulse. Your heart sounds. If you can go ahead and stand up for me. Do you suffer from any heart problems?
No.
Any family history of heart problems?
No.
Any medication for heart problems? No? Okay, if at any point you feel dizzy, go ahead and let me know and we can go ahead and stop, okay?
Okay.
Go ahead and stand as still as you can for me. Go ahead and check your lung sounds. Do you feel any tightness when you breathe?
No.
Do you feel any shortness of breath? Do you use any inhalers? No? Okay. I'm gonna go ahead. Is there any family history of any breathing problems, any lung problems?
No.
Huh? Okay. Let me go ahead and listen. I'm gonna have you breathe in and breathe out for me for 1 full minute. If at any point you need a break, let me know, okay?
Mm-hmm.
Go ahead and breathe in, breathe out. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. go ahead and swallow for me? Okay, do you have any trouble swallowing?
No.
Okay, go ahead and turn around. Thank you very much. Now I'm gonna go ahead and listen to your lung sounds again, okay? Again, go ahead and breathe in and breathe out for me. Breathe in, breathe out, breathe in, breathe out. I'm gonna go make sure it's not on her bone. Go ahead and breathe in, breathe out. Go ahead, how do you feel?
Good.
Okay, I'm gonna go ahead and have you bend down and touch your toes while I assess your spine. Okay, I don't notice any deviation or curvature. Go ahead and stand up. She would be wearing a gown. I would check her back for any wounds, any pressure ulcers, any bruising or any scarring. Go ahead. And now I'm gonna go ahead and do the 99 test. Go ahead and say 99 for me.
99.
99.
99.
99.
99.
Thank you very much. Okay, so now I'm gonna go ahead and have you sit for me.
Okay.
And I'm gonna have you do the sit and go test. That just means you're gonna get up and walk in a straight line for me, okay? So get up and go ahead and walk. I don't notice any limping or that any swaying or that you require some assistance to walking. So right now I'm gonna go ahead and do the Romberg's test.
Okay.
That just means you're gonna go ahead and stick out your hands for me, straighten ahead, close your eyes, and okay, good job. Thank you very much. You can go ahead and, how do you feel?
Good.
Okay, so before we sit down, we're gonna go ahead and do your range of motion exercises, okay? And start with your shoulders. Do you have any stiffness or any dislocations or any
No.
pain at the moment? No? Okay. So go ahead and with both arms, stick out, top, down, down. Okay, forward, up, middle, down. Now your wrists, if you can go ahead and rotate them for me. Fist, open, fingers out, and close them. Okay, can you hyperextend your wrist? Down, okay. Now can you go ahead and rotate again to the other side? Your wrist, okay, good job. So now your legs. We're gonna go ahead and stick our leg back in, other leg. Okay, good job. Can we rotate our ankle, our other ankle? Okay, good job. If you can go ahead and take a seat, and I'm gonna go ahead and assess your pulse points that I didn't assess, or did your temporal and your carotid. I would do your radial bilaterally. I would do your brachial. Do your femoral and change my gloves. So I'm gonna go ahead and check your tendons. I would start with, can I borrow your hand? But no, the thigh. One. We're gonna go ahead and I'm gonna have you lay down while I assess your abdomen, okay? Have you had any surgeries in your abdomen?
No.
No? Have you had have you noticed any masses growing? Do you have any tenderness, any pain right now? No? Okay, so I'm just gonna inspect your abdomen first.
Okay.
So I don't notice any scarring from any previous surgeries, any wounds open, or any stomas like you have. I'm gonna go ahead and listen to your abdomen first, okay? Go ahead and stay still for me. I would listen to all 4 quadrants for 1 full minute, each quadrant for 5 vowel sounds. If I didn't hear a vowel sound, then I would go ahead and stay there for 5 full minutes. So now I'm gonna lightly palpate on your abdomen. If you feel any pain at any moment, let me know, okay?
Mhm.
So if at any point when I'm palpating at her McInerney's point, I notice any like grunting or her leg moves, then I would go ahead and stop at that point. Okay, do you have any pain?
No.
Move on to your private area, okay? Have you had any babies
No.
vaginally or C-section? No? How's your period? Normal?
Mhm.
Does it come every 28 days? Have you noticed any discharge? Any smelly odor? No? Okay, so now I would put her in lithotomy and assess her private area. I would go ahead and open her labia minora, her labia major and her labia minora, and assess for any warts, any lesions, any bruising that might have been there, any discharge, any smelly odor. I would as well assess her rectum, her anal area, her perineal area to make sure that there's as well no hemorrhoids or fissures there, that there's no open wounds or pressure ulcers on her behind where she, on her coccyx. Uh, go ahead and move on to your legs. Do you notice any swelling, any pain?
No.
No, I don't notice any pitting or any swelling at the moment. Okay. I don't notice any wounds or any redness spots that may indicate a DVT. I'm gonna go ahead and have you remove your sock. I'm gonna remove it for you so I can check your capillary refill. Her nails are painted. Good job. The back of your heel, I don't notice any pressure points. Any pressure ulcers, not even on your heel. I'm gonna go ahead and put your sock back on. Go ahead and have a seat for me. And one last thing before I'm done, I'm gonna go ahead and uncover your clavicle to check for any need anything. Do you feel fine?
I feel fine.
Okay. Thank you very much.
Thank you.